Hi guys, so today we're going to be going over analysing ECGs for beginners, and today we've broken this down into a 6-step process. So to begin with, we need to look at what is the rate and what is the rhythm. Now, heart rate is typically shown on the ECG tracing anyway. However, it's always good practice to calculate it for yourself, and this is done by dividing 300 by the number of big squares between each QRS. So, for example, with the top ECG tracing, there are about 4 big boxes or big squares between each QRS. So 300 divided by 4 is a heart rate of about 75 beats per minute. And the normal range for adults is between 60 and 100 beats per minute. When we're looking at rhythm, we need to determine if the QRS complexes are evenly spaced. Now you can see on the top ECG tracing that they are evenly spaced, whereas on the bottom tracing they're not evenly spaced. You've got some that are quite close to each other and some that are further apart, and that's because this patient had a condition called atrial fibrillation, which causes an irregular heartbeat. So the next thing we need to look at are the P waves. Now these represent depolarization of the atria. We should be seeing one P wave followed by a QRS, and there should be one P wave for each QRS and vice versa. So there's a 1-to-1 ratio of P wave to QRS. And that's what we see in the top ECG. In the bottom ECG, however, there are P waves which are not followed by a QRS complex, and that's because this patient suffered from a condition called a heart block, where there is disease to the electrical conduction system of the heart. The next thing we need to look at is the duration and the morphology of the QRS complex. Now, the QRS complex should be less than 120 milliseconds, which is equivalent to about 3 small boxes. In the ECG example given here, you can see that the QRS complexes are all slightly more than 3 small boxes wide. So we'd say that this is a wide QRS complex, and that's because this patient had a condition called a left bundle branch block, where there is, similar to the last slide, where there's disease to the conduction system. Now, regarding the morphology of the QRS complex, when we say morphology, we're sort of talking about the shape of it. So where there's positive deflection and where there's negative deflection, there are many different things that you can look for on an ECG, and that sort of goes beyond the scope of this video. However, one of the main things you can look for is that the QRS in lead 1 and lead 2 should be mostly positive, which suggests a normal cardiac axis. If you have anything other than that, so for example, a positive QRS in lead 1 and a negative QRS in lead 2, that would suggest something called axis deviation. So next we're going to look at the ST segment. So the ST segment should be at the same level as the baseline, which you see just before the preceding P wave. The example of the ECG given here shows an elevated ST segment in some leads, which is highlighted in orange, and then a depressed ST segment in other leads, which is highlighted in blue. That's because this patient was having a heart attack, which is a type of acute coronary syndrome. So the next thing we're going to look at are the T waves and the QTC. So the T waves represent the repolarization of the ventricles, and they should be upright in all leads except V1. So it's quite common to see an inverted T wave in V1. However, some patients will have inverted T waves in other leads, and that might be normal for them, although new inverted T waves can also be a sign of problems such as acute coronary syndrome or electrolyte disturbances. So it's always important, if you've got inverted T waves, to try and find an old ECG of the patient so you can compare to see if these are new changes or not. Additionally, we need to look at the QTC. So that's the duration of the QRS complex and the T wave combined. Now, this should be less than 450 milliseconds, and that's typically calculated for you on the tracing. As a general rule of thumb, if the end of the T wave is less than 50% of the way to the next QRS complex, then the QTC is probably okay. We've given an example here at the bottom of the slide which shows a grossly long QTC, just so you can see, for example, so the end of the T wave is almost reaching the next QRS complex, and that's because this patient has a condition called congenital long QT syndrome. So finally, you need to be able to relate all of your findings and all of your analysis on the ECG to your patient, of course, along with the rest of your patient analysis. So you need to be asking questions such as, what is wrong with your patient? You need to ask yourself if you think your patient is at risk of deteriorating based on what you found and what you think is wrong. Do they require any further management in hospital, any specialist interventions which you can't provide in hospital or in the community setting? And you also need to consider if there's anything you need to do right now for your patient, interventions that really can't wait until the patient gets to hospital. Okay, that is everything, and thank you for listening.